you know, when I was in the House, I worked on the telehealth issue. We had this legislation. We thought we were going to get it in the 21st Century Cures bill. We did not. So we moved it as a standalone. And of course, once COVID hit, everyone said we need to have telehealth on the books. So it came in through the emergency health order, and being able to make these waivers, the COVID-19 waivers, permanent is something that I am hopeful we are going to be able to do. What we've learned is that seniors, elderly, people with complex medical issues, people that have their primary source of care delivered at a great distance, they have really benefited from this. And one of you mentioned in your statement the increase in access and the additional number of appointments that an individual would have. So I'm doing what I can, and I know that Senator Cardin and Senator Daines are doing what they can to work this issue through to the end of the year and make it permanent. Dr. Wallace, I want to ask you about this. CMS has a rule that would require physicians to report their home address. And let me get you to weigh in quickly on that. And is it Dr. Ilamatil? Did I say that anywhere near right? Are you sure? Okay. I'm just making sure there. I'd like to hear from you on that also. But the significant concerns that may come from that, if you feel like that's of a concern, having to have that. And then if that requirement had been in place during COVID, what would it have done to access to care? So Dr. Wallace, you go first. Microphone.
Yep. Thank you, Senator, for the question. So our institution, when that rule was being evaluated, and it has recently been addressed in the new PFS rule. However, operationally, we would not be able to do it. We have 1,100 providers at UAB. We have residents, et cetera, and they are providing health care in many locations. They could be in their office. So one of the questions that came up is if they're not in the clinic, but they're located in their physical office across campus, do we need to report that address? Is it the home? So there were so many operational hurdles on doing that. It would be a major problem. The other thing was privacy of the physicians.
Yeah.
I think that is many physicians would not actually do telehealth and would opt not to do telehealth if they had to report their address publicly.
Well, and I would think that the consistency of your permanent business address should be sufficient. Yeah,
I agree.
Dr. Ilamatil, go ahead.
Thanks. I'll be quick because I agree 100% with those comments that privacy has been a major concern for us, as was the 100 organizations that sent a letter to CMS to try to avoid this situation, and then also operationalizing it. We have 3,000 plus clinicians. We have providers that see patients in multiple different locations. We have people that or providers that may move or stay in temporary housing. So I think all in all, it's very difficult to operationalize, and then the privacy concern is the other issue too. But I agree with your point about the policy option there, which is where your patients are being seen in person, which is where your expenses are. So my understanding is a lot of this has to do with payment adjustment, so it's where your patients are being seen in person is likely the best address.
Yeah. Okay. Dr. Marotta, I want to come to you on digital health and chronic disease management. Some of the providers I've talked to in Tennessee have said that patient compliance is always a problem, and that patient compliance through COVID with diseases like diabetes, that it was much better because people had that accountability of the telehealth, that they had to show up for that virtual appointment. And when you look at diabetes, and it's $327 billion a year to treat this, talk for a minute about the ability to use telehealth and digital health for coaching, for education, for pushing toward compliance.
Thank you, Senator. Great. You're raising a really important point. I will say briefly that our research has highlighted that greater use of telehealth does improve that major issue that you described as compliance with people's medications. It was also touched upon remote patient monitoring, and I think that's a very effective way in terms of helping patients in terms of staying on their medications and getting the care that they need. So these are some examples of how this real innovation in digital health can improve chronic illness in the United States.
And I've run out of time, and I know there are others. I've got a couple of other questions on that, but I will submit those. I feel like this is an area we can choose to put some emphasis on and expand. Thank you. Thank you, Mr. Chairman.
Thank you. Senator Cortez Masto?
Thank you. Thank you, Mr. Chairman, and to the ranking member. Like my colleagues, I support telehealth services. I think they should be permanent for the very reasons that you're all saying, and there's other areas and barriers that we have to address.